Welcome, everyone, to our third webinar about healthcare. I am Jeannie Nicholson, a former state senator and a former public health nurse. I'm going to start with a story. I walked in to my doctor's office covered in hives. I was having difficulty breathing. My throat was closing. And I walked up to the front desk and I said, I'm Jeannie Nicholson and I'm going into anaphylactic shock. And the woman behind the desk said, that'll be a $20 copay. So, when in our society and why did our society decide that profits were more important than patients? Unfortunately, that is the status right now, and we are here to change all of that. It doesn't have to be this way. And our work, inspired by all of you who are participating today, is about making sure that everyone has affordable, comprehensive health care in Colorado throughout their lives. And quickly, I'm going to cover the agenda for you so you know what to expect. We have Chip Bear, a business owner, joining us tonight to explain how the current healthcare plans affect his business. We have a businessman who was a former chief financial officer for big corporations, Greg Smith, joining us to talk about how our current healthcare plans affect um, big corporations in a very negative way. And we also have a clip from Joe Hanrahan, who owns a bicycle shop in Durango, who's going to be talking about how it affects his business. And then we have the very special treat of Rose Roach, who will be speaking to us about how this affects the employees, labor. She is the national coordinator for the labor campaign for single payer. And then after Rose speaks, Virginia will describe the Stanford study, and I will invite questions from all of you for our speakers. And then Kirby will finish our evening presentation to you by talking about relational building and requesting donations from all of you and announcing the next webinar in August. So first off, we will begin with Chip Bearer. If I see Chip, um, maybe Chip is trying to get online. We'll give him a few minutes to do that, and we'll ask Greg to go first since Chip is not here at the moment. So let me introduce Greg. Greg Smith is a very strong supporter of us having affordable health care in Colorado. And as I mentioned, a chief financial officer in the past for big corporations and knows how this affects them. And of course, I always have to mention he is married to a nurse. So, Greg, please
Yes,
begin.
sure. Thank you for the introduction, Jeannie. As Jeannie mentioned, most of my experience with healthcare on the business side has been from a financial perspective. And the way I typically dealt with it was on the cost side. Every year, sometimes less frequently, but usually a year, companies have to re-up their insurance plan, and typically they will search for new ones because what they find is the cost of health insurance has gone up quicker than inflation. And as a CFO, it's like the last thing you want to do is come into the offices of the president of the company and say, guess what? A cost has gone up and you're not going to get anything more. You just get to buy the same thing again this year. So I've had that conversation a lot, and believe me, it makes an impression on you. But that's typically how I dealt with it. I'd like to give you a little bit broader perspective than just me. I attended a focus group a while back with 8 business people in it. It included CEOs, it included CFOs, it included corporate lawyers, some pretty heavy executives. And I'd like to tell you what they think of healthcare. Because one question I get a lot is, why aren't more business people helping or interested in health reform? So here's what my colleagues had to say. The one issue that you get unanimous and quick agreement on is cost. Everyone thinks it costs too high, and they're annoyed by the cost, and they'd like to see it come down. And as I mentioned, that's my perspective on it. That was my introduction to healthcare. Interestingly, there's a couple other things that kind of resonate with them. The idea of decoupling health insurance from employment is something that most business people support. A lot of business people, they start out as entrepreneurs, they started their own business, and they're acutely aware that the fact that people typically need to join a corporation to have health insurance kind of slows down innovation in the United States, because people are hesitant to start their own companies. Now, that's changed a little bit with the Affordable Care Act and the exchanges, but it's still a big issue for a lot of people. So they'd like to see it decoupled from insurance. They think Medicare works well. They are, however, skeptical about a few things. And I think it's important for people who are looking at business and can they support reform in healthcare to understand their points of skepticism. They're very skeptical of one class of care for all. In general, as you would expect, I think, from a business audience, anything new or higher taxes, they tend to be skeptical. And, some people will frame payments being repurposed from going to an insurance company to a universal healthcare plan, they will say that they will call it a tax. And while we could argue about whether that's fair or if it's true, the fact is business people hear that message and it perks, their ears pick up. They don't like new taxes. The idea of central control by what they call bureaucrats or politicians typically is not a plus. And one thing that surprised me the first time I heard it, but it makes sense now, a lot of businesses are surprised to hear the USA has an access problem for some of our poorer citizens. They go, literally, I've had this conversation. They go, what do you mean? I have great health care. What do you mean there's an access issue? Anytime I need to go to the doctor, I go, I don't understand. And you have to explain it to them that, not everybody has health insurance, or some people have plans that have such a high deductible that they don't use it. So there's a big education component. I'd like to close with a couple quotes. Warren Buffett, who's a famous investor, he just retired, but he's still out there and around, said that healthcare costs are the tapeworm of America's economic competitiveness. And he's absolutely right. And I think a lot of business people know that he's right. So that's a plus long term for the reformers. I'd like to share another quote. This is from his partner, and a guy named Charlie Munger, who died recently or in the last couple of years. But a friend of mine was in a private meeting with Charlie, and they ended up talking about healthcare. And Charlie said, and this is a direct quote, "Single payer is the least dirty shirt in the closet." And the males in the audience will know what I'm talking about, but here's the terrible secret about the male population of America. Sometimes our shirts are not clean, and so we look for the least dirty one to wear. It's shameful, but it happens. And that's what Charlie was talking about. And what he's saying there is, he's saying all the other negatives that people sometimes say. It's, yeah, you can argue it's a tax. Yeah, you can argue it's a new government program. But the fact is, it's better than the alternative. And for that reason, we should support it. So I was encouraged that even Charlie Munger thinks healthcare reform is a good thing. So I'm done if anyone has any questions.
Do we have any questions from the participants? Les, go ahead.
Yes. Why are some employers more likely to go for universal health care or more? Why do some employers understand uh, the value of single payer and other employers don't? I mean, you talked about education.
Yes.
You have some good examples of people that became employers that became whistleblowers when they finally got saw the light. And maybe it has to do with the kind of company they have. You know, you get these crazy insurance offers by Amazon, $5 a week, and you can get health care and all this
Really?
crazy.
I think thank you for your question. It's a good one. Business employers are not a monolith. Some are interested in, societal issues like access to healthcare and trying to help employees. Generally speaking, I think it's employers with uh, a lot of employees who are paid less and therefore don't have health insurance or having trouble affording it, who those employers tend to be more receptive to reform. Um, but some are, some aren't. I don't think we'll ever get all or most of business employers supporting universal care. Kind of the typical business in the United States is extremely competitive. To build a company and be, an executive in a successful company really is a kind of an all-consuming effort, and they just don't have a lot of bandwidth to look at other issues. And this is a little cruel, but they view as reform of healthcare as somebody else's problem. They're swimming in a sea. The sea is populated with the current system, and their goal is to figure out how to navigate that system, not change it. And that's how most of them look at it. But there are exceptions, and there's some businesses that are interested in reform to help their employees.
Greg, Elaine just asked a question about what term would resonate best with the business community. Single payer is one phrase, publicly financed is a different one. Is there some terms that we should avoid with the business community and others that are more effective?
Um, Boy, that would be a great subject for a lot of marketing research. The problem we've got is those opposed to reform have picked up on the terms that we use, such as single payer, such as Medicare for all, such as universal health care. And they've got a pretty steady negative playbook. And so it tends to turn people off. So I tend to turn the question around a little bit. What would resonate with business? One thing I think would resonate with business is making it simpler. Businesses do not like the complexity of administering COBRA. They don't like the complexity of having to bid this stuff constantly. They don't like the complexity of having to make decisions about deductibles and, okay, we're going to cover this, but not that. Copays, all that stuff, it's not core to their business. They would like to be done with it. So I think to the extent that we can emphasize simplicity, we're going to make things work smoother and get the cost down and sort of stop there. I think when we use phrases such as phrases that really put front and center that we're trying to help the country, they're less receptive to that because that's not what they go to work to try to do. And that's a little harsh, but I think that's the reality. We need to look for ways to describe it in a way that makes their experience in business, their competitive ability better.
Thank you, Greg. Chip has joined us. Fortunately, Chip, welcome. I'm sorry there was a snafu with the technology, probably my fault. But welcome. Chip Bear owns Bojo's Pizza Restaurants in Colorado and is a strong supporter of changing the way we pay for health care to make it more reasonable for businesses like his. So, Chip, please go ahead and tell your story.
Okay, and it was probably my fault. I've been having these challenges with technology all day, so no matter what you did, it probably wasn't going to work for me. Sorry about that. Anyways, yeah, I've been in business for 53 years, and one of my primary things that I wanted to do when I got into business, really felt it was important to take care of the employees. My father had been the personnel director for Minnesota Power and Light Company up in northern Minnesota for many years. And one of his primary things was always negotiating with the unions to get the best health care and stuff like that. And it was an ongoing thing. And they did a really good job. They provided excellent health care for their employees, but they're a big company. They had deep pockets. For small businesses, I think it's a different story. And just healthcare overall, the way that we do it in this country by having the businesses fund it, I think is a problem because so many people are stuck in jobs that they don't want to be in because that's where their healthcare is. Again, when I first started out, I wanted to be able to offer healthcare to my employees. I've never really been able to do it. I've tried and tried and tried. Currently, we'll pay for our hourly, we pay our managers' health care, but for our hourly employees, we'll pay
Yes,
70%.
steak
Um,
burrito with queso.
I'm sorry?
There should.
If you would mute, if you're not speaking right now, that will help Chip Bear go ahead with his presentation. Go
Okay,
ahead, Chip.
I'm sorry. Um, Anyways, like I said, I've got about 300 employees. Uh, and out of that 300 employees, I think I have about 30 employees that take advantage of our, I think, pretty generous payment of 70% of their health care. Most of them feel they can't afford it or they don't need it. Again, in the restaurant industry, a lot of the employees are pretty young, and they generally feel like they're invincible until they get into an accident or something happens. The people that do get the insurance definitely appreciate it, but I think that we really need to be doing something better, not only for our employees, but for ourselves. Our healthcare system is just totally broken. The way that we finance it, nobody else, none of the other industrialized countries on the planet do it. We pay so much more for inferior a product. We have the ability to get really good stuff if you've got the money to pay for it and you can navigate through all the hassles of our healthcare industry, but it is just totally broken. And my feeling is that starting with single payer funded care would be a real good way to start to fix our healthcare system. I've been visiting some doctors lately, talking to some of my providers, the nurses, and so forth, and they all say it sucks. It's horrible. We wish it could change. That's pretty much it.
Chip, thank you very much. Maddie, you had a question, and if you would like to ask Chip that question, please go ahead.
Sure. And sorry I was late. Greg, when I came in, you were talking about um, that businesses don't think this is their business and they have other things that they want to think about. And I could have missed part of what you said, but it seems to me it should really appeal to businesses to not even have to deal with this. And in a single payer system that isn't necessarily hooked up to payroll, which I personally don't agree with, not having, I don't see any reason for it to be hooked into payroll. But, I just really am kind of confused why they are willing to continue to put up with having to do this every year with higher prices and worse benefits.
I don't know the answer to that question. It confuses me also. A lot of times, again, it's just easier to go along. Change is really hard. People avoid change and they know what it is. They've been dealing with it for years and years and years. And I think that they just don't want to get involved in trying to change. But I think more and more people are figuring out that this system is just not working the way it was intended to. I think there's a shift.
Les, do you have a question? You're muted.
How much corruption is there in the negotiations with the bigger companies? Like in New York, they finally got, Medicare for because the people that are the middleman, is that the problem? I mean, have you run into middlemen that wanted more money than that took away from the value that you were going to give to your employees?
Uh, we're not big enough to even get involved in that. We have a broker that we deal with that goes to, 3 or 4 different insurance providers in the state, and they're getting less and less all the time with more restrictions. They give us 2 or 3 different scenarios that we can go with, and we don't really have a whole lot of negotiating. We got, okay, here's this plan, or this plan, and good luck.
Greg, do you want to respond to that from the bigger corporations' perspective?
I've never encountered corruption. It's things like kickbacks, favors like that is considered stealing from your employers. And everyone I've ever worked for, if you got caught doing something like that, you're not only are you fired, you're prosecuted. So I've never seen it. There's no doubt that it happens. As far as Maddie's question, doesn't understand why business, it's mostly an education issue. I mean, a great war story that I like to tell, and this isn't business, but it's typical. Patty Gabow, who used to be the head of Denver Health, she's a physician. She had lunch with Paul Ryan, the Speaker of the U.S. House of Representatives. This is like 10 years ago. And they talked about healthcare. And he literally said to her, he said, I don't get it. My healthcare is fine. What's the problem? And I think a lot of business people look at it like that. It's an education issue. When you educate, I think a big part of our push to bring business on board has to be education.
And I would add that it's not only education about the people who don't have access, it's education to the people who do have coverage, that their coverage is not as good as they think it is when they truly have to test it with some really significant health challenge that costs the insurance company a lot of money. That's when they run into the denials and the delays that they have never experienced if they only go in for an annual checkup and maybe one knee replacement, which isn't going to be denied or delayed necessarily. So, anyway, we need to move on. And Chip Kirby is going to play a clip about Joe Hanrahan, who owns a bicycle shop in Durango and also feels we need to change the way we pay for healthcare. So go ahead, Kirby. Yeah,
Durango
Kirby.
Cyclery is Durango's longest just sole running bike shop. It was opened in 1981. It's always been a community-based shop. Bike shop people, they're incredibly valuable. Their skill sets are incredibly valuable, and I try and pay everybody a livable wage. We're all still out there riding bikes. That's what we do, and we can get hurt out there. So as a small business owner, I would love to be able to provide every one of my employees some option for healthcare. If I don't have mechanics to do repairs, that affects my bottom line. Everyone loves to romanticize small business, but in the reality, it's incredibly difficult for small businesses to afford and deal with the rigmarole health insurance. I'm a well-educated person. I have an MBA. I look at my health insurance bills when I do have to take a visit to the ER, and they're mind-boggling. And I continue to get little tiny bills 6 months to a year after I've visited the ER, and I can't make sense of it. I don't know what I paid. I don't know why I'm paying what. All that on top of one another and the cost of insurance, nearly impossible for a business my size to provide health insurance. it seems to be a broken system. I think it's frustrating. The model that health insurance is tied to employment in this country, that seems to be a very common occurrence, is that people that work in small businesses have a spouse who works in a more lucrative or professional field, and they have access to that insurance. But they're tied into that insurance too. They're all locked in, and they have to think about if someone's going to move a job, what do we do for insurance? Case in point, his wife is a teacher, and all their insurance is tied through that. So if she were to get laid off, I would lose my employee. I think Medicare for all is a viable solution. It's allowing people to spend their money in better ways doing other things.
Thank you, Kirby. That was terrific and really great to hear from Joe Hanrahan, as well as Chip and Greg. Next, we're going to move on to hear from Rose Roach. As I mentioned before, Rose is the national coordinator for the labor campaign for single payer. Rose, please go ahead with your presentation.
Awesome. Thank you, Jeannie. I am going to just make sure that I'm pulling up my slides because I have some slides. Are you seeing the slides or is my notes in the slides?
We see both.
You're going to see both. Okay, so then I'm pulling up the wrong thing. This is just driving me nuts tonight why I cannot seem to get this correct. I do not know. How about, is it the same thing?
There you go.
Now it's fine.
Okay. Now it's fine. All right. I'm so terribly sorry. Well, first of all, greetings of solidarity and health from the Labor Campaign for Single Payer. Thank you so much for this wonderful opportunity tonight to explore ways to bring labor into your health justice movement and why it makes sense for for workers to support Medicare for all or single payer. I'm going to talk kind of fast because, as usual, I got lots to say. So let's go ahead and get started. It's critically important to recognize first and foremost the fact that there is no question that unions have helped to shield working families from the efforts of corporations to dump healthcare costs onto the backs of individual workers and their families. Most union members have better healthcare benefits than non-unionized workers. However, it does comes to at a cost, right? We still have situations, great plans, but guess what? For some reason, we got to buy separate insurance for our eyes, our teeth, our ears. I mean, it just doesn't make any sense. More and more employers, as we heard earlier, are moving away from being able to even provide dependent coverage because of the cost. It's too much for employers just as much as it is too much for workers. You still are seeing huge copays, deductibles, and out-of-pocket costs, even if you do have a fairly decent plan. Of course, we all have to deal with the idea of networks and these limitations on providers. And when you negotiate health benefits, again, it's a bargaining chip. It's one of those things on the table with everything else, and there's only so much money that's available. And so constantly taking a bunch of that money and having to move it out of our pocket as wages and into something called health insurance, which just goes into these for-profit, health insurers' bank accounts while they're denying us care at the same time, doesn't make a lot of economic sense for any of us. So it really still continues to be the number one issue and dispute between employers and employees in this country, especially when we see strikes and things of that nature. So, here's what the real impact of wages looks like when comparing workers' earnings. The dark blue line in the middle there is overall inflation. The light blue line is to the rise in costs of family premiums, and the orange, that's the orange line. I should have said that I'm so sorry. I'm trying to do it too fast. Overall inflation is dark blue. Light blue is healthcare inflation. And then you have got the cost of premiums. That big open, I call it sort of an alligator mouth, is not sustainable in our economy. The economic cost of this benefit to us as workers is just too high. Between 1999 and 2017, there was a 213% increase in premiums, which resulted in a 242% increase in workers' contributions. It's just crazy. It is not sustainable. Health insurance benefit are being used as a means, kind of an answer to one of the questions that came up before. In some cases, in a unionized workforce, it's being used to divide and conquer us. As you said, it's tied to our employment. So we go on strike, and guess what? The first thing the employer will do, they will remove you from the roles of their, their health benefits, because why wouldn't they? It's a cost. You're not working anymore. So now you lose your access to health care simply because you have exercised your right to withhold your labor and to go on strike. So it is really an enemy, I believe, that belongs to both labor and management. And I have been in both labor and management. So I know what that looks like. And I think it's a place where we should figure out how to come together and fight that common enemy together. So, the labor campaign has lots of really good resources. One of them is it's a training that we do that is called Labor Campaigns, Runaway Inequality and the Crisis of U.S. Healthcare. And it's a way for workers to really look at the economic impact of what is a so-called benefit, right? This insurance that is and access to healthcare that's tied to our employment. So you can see here, there are a couple of questions that really make some sense. You can sort of start, if you're talking with a worker, to say, hey, have you ever had to give up wage increases in order to, buy down a premium increase? I haven't found anybody yet that has said no to that when they've been at a bargaining table. Have you ever had to make changes in who you get to see as a physician or a hospital or a clinic because you've had to change networks because the employer has figured out that the cost is too high with whoever you were with last year, and they're going to have to switch to somebody new. Very, very common, as you all know. So that interrupts many times our treatment of care, right? That's hard for us to deal with. Retiree health care, barely a thing anymore, to ensure that retirees have some sort of access to health care along with Medicare coupled up with it, or even some early retirement coming into play. Those are all things that we are paying for, no matter whether we think we are or not. If we think we've got a great health insurance plan, don't kid yourself, you're paying for it somewhere. You've most likely given up wages in order to keep that good health insurance plan. I wanted to center a little bit of this presentation around a recent article by Jared Abbott. This was in Jacobin, and it is Jared happens to be a researcher at the Center for Working Class Politics. The article is called Medicare for All is an Electoral Winner. It's a terrific article, and one that's applicable really to the topic of bringing labor into the health justice movement, and how do we sort of message why this is good for workers. Abbott makes really 4 salient points that I want to bring up here about how we really frame talking about Medicare for All with workers. Number one is to tie coverage to work and contribution, not necessarily to government generosity. Think of this as an analogy to Social Security. We work hard our entire life. We pay into that system, so we deserve that money as part of a dignified and economically secure retirement when we retire. It would be the same with a Medicare for All system. This frames the benefit as something workers have already earned, the same durable support that has protected Social Security for 90 years. You've worked hard to provide for your family. You shouldn't have to choose between paying rent and seeing a doctor, is a very working class healthcare sort of message. The second point is to make the insurance company the villain. That's not very hard to do, right? But don't necessarily make the government the hero. I mean, I often hear, well, I don't want government to, get in the middle of my healthcare. Well, I don't either, but I also don't want my boss in the middle of my healthcare. I don't want corporations in the middle of my healthcare. I want healthcare to be about me and my physician and my family. That's what we're talking about here, because healthcare is a particularly promising terrain for economic populism, because these villains are so concrete, and the harm harm that they cause is really visceral. Insurance company executives, pharmaceutical profits, prior authorizations, surprise billing, medical debt, they are not abstractions. Working class voters respond powerfully to messages that identify a specifically named villain who is ripping them off. This matters especially because one of the most potent attacks on Medicare for All is about freedom of choice. Opponents constantly argue that a single payer system strips workers of choice, but the choice is to keep their plan, not necessarily their doctor, their options. They attack because working class voters are genuinely skeptical of arguments that feel they're being told what to do by the government bureaucrats in Washington whom they don't trust. With workers, we need to focus on who is actually doing the restricting. And right now, that's insurance company executives, not the government, who decides what care we get and when we get it and which doctors we get to see and whether our claims get approved. Prior authorizations are not freedom. A surprise bill is not freedom. Medical debt that follows you for decades isn't freedom. The winning concept isn't government run versus private insurance. It's a system where insurance executives decide what care you deserve versus a system where you never have to choose between your health and your financial survival. That reframe does two things at once. It turns the freedom argument against the opposition and activates populist resentment toward a concrete economic villain. So it's really, really worthwhile for us to think about how we reframe the way we talk about Medicare for All. Number 3 is expand, don't replace. Workers are far more comfortable with policies as expansions of existing trusted programs. And for the most part, Medicare is a trusted program, as far as the government programs go. So we've already done some polling on this, and a policy limited at expanding Medicare to covering vision, dental, and hearing. 90% of the people out there say, yeah, let's do that. Let's include them in Medicare. Maintaining or increasing federal spending on Medicaid still stands at 82%. Medicare drug negotiation is at 85%. Lowering prescription drug costs, 87%. Even an expanded Medicare for All universal form of healthcare gets 58% support versus 43% for a framing that explicitly eliminates private insurance. These are the incremental steps that we need to take to build our public health infrastructure that leads us to Medicare for All. And we're talking about that on a national level all the time by going ahead and trying to expand current Medicare, setting it up for all of us eventually to be in it when we pass Medicare for All. Medical debt is a kitchen table issue. And it's also a crisis for the working class voters across the United States, and one that for the vast majority was not caused by laziness or bad decisions, but by an insurance system that denied a claim, buried a deductible, or sent a bill nobody saw coming. That origin story matters a lot because it connects the cost workers are already paying to the corporate interests profiting from them. The strongest Medicare for All message doesn't lead with how the insurance company would be restructured or the role of government would play in a future system. It says instead, no more medical debt, no more surprise bills, no more asking permission for a claims adjuster before you see a specialist. It focuses on making insurance companies irrelevant. What do we need them for? Why are they there? They're superfluous to healthcare. They're putting obstacles between us and our physicians. We do not need them. Franklin Delano Roosevelt built Social Security's contributory payroll structure specifically so workers would feel they had earned their benefits, even though in reality, current workers' taxes fund current retirees' Social Security's checks. Because, as he put it, no politician would ever be able to take something away that people felt that they had paid for. Putting this logic at the center of our messaging is an effective way to talk with the working class voter about Medicare for All. The reality is that labor must be at the table from the beginning. So be sure that you include labor, whether they're a union is pro single payer or not, every voice matters, and you've got to have the stakeholders in the room. It is really important to not say we wrote this great bill and we want your endorsement, but instead to say, what do we need to include in the bill to ensure that your concerns are addressed? We've done this on a national level. We're doing it here in the state of Minnesota on a state level with our state bill, like you're working on yours in Colorado. Unions of necessity, remember, are multi-issue organizations. They're not monolithic any more than business is. So learn to speak their language and understand their concerns, understand and address the institutional considerations that may affect unions' positions. It's really important to be there for them when they need your support. Show up for them. Bring them into the room, include their voice as you're preparing for your next step in your campaign. Resolutionary politics and practical politics often diverge, and many resolutions that are passed, pro single payer resolutions at unions are put in a desk drawer. You may need to remind local leaders of their national union's position or find a way to encourage them to move beyond their position. Show up at their events. Central labor councils, political campaigns, and community service often attracts the most visionary and progressive elements of the local labor movement. These are your key respected leaders. Find them and talk to them. There's a great video you can find. I'm going to send my slides to Virginia so she can send them out. It's got the link in it. New York State Senator Gustavo Rivera did an incredible job in laying out the case for the New York Health Act to unions in New York. We should take note because he provides strong talking points for us to use when working with labor unions in our own states, such as single payer doesn't take healthcare away from unions. It takes healthcare back from insurance companies. Labor gets more with single payer, not less. The next big fight is healthcare. Unions have fought for healthcare. Now it is time to fight together to make it universal. So in other industrialized nations, as was mentioned, we know that healthcare for all is provided and labor unions are part of that. It all makes sense. There's plenty for us to do when it comes to the bargaining table. It's important to know that change is coming to the U.S. healthcare system, and it's imperative that the labor movement be involved. Medicare for all would take healthcare off the bargaining table, allowing us to use our bargaining power to improve wages, pensions, and working conditions. Medicare for all is one way to take back some of the wealth that we've been robbed of. And if we're going to make such a massive change, it's really important that that labor be part of that massive change. So tying healthcare, access to healthcare is a failed strategy, makes zero economic or humanitarian sense. Our access to healthcare has become a weapon in this class warfare that we're all engaged in. We have to do what is necessary to make healthcare politically possible for all of us. The Bug's Life up there says you let one ant stand up to us and they all might stand up to us. Those puny little ants outnumber us 100 to 1. And if they ever figure that out, there goes our way of life. Well, no one has figured that out better than labor. It's time to amplify everybody's better way of life. So thank you very much for having me here tonight. Si se puede.
Rose, thank you so much for a great presentation. That's fabulous. And it gives us a lot to think about, not only in terms of how to work closely with the unions in Colorado, but what the language needs to be. One point that you made that I think is really important is that we need to be reaching what I call the rank and file union members. Sometimes when we only meet with the leadership, they create a barrier to the rank and file. Jokingly, I was standing in line at a grocery store and a bunch of guys with electrician t-shirts on were in front of me. So I engaged them in a conversation about whether they thought as electricians that we should change the way we pay for healthcare so they had really good coverage. And they just looked at me and said, well, absolutely, of course. So I think one of the keys that you pointed out is we need to reach the union workers themselves, as well as understand any of the overall concerns that the union leadership might express.
Absolutely.
So I'm going to open it up for questions for all of you to ask Rose. Are there any? Oh, Maddie, please go ahead.
Rose, you are such an inspiration every time I hear you. Thank you so much. Um, a couple of references made earlier in this webinar were about how our healthcare system is, quote, broken, unquote. And I think it's worth considering changing our messaging that it's working exactly how it was designed to work by people who want to just deny our care, take our money, and make a huge profit. So I think, we need to be careful of that. And I love you talking about making the insurance companies the villains. And we had a recent talk with Wendell Potter, who, said the same thing. They're the one profiteer in healthcare that increases their costs and decreases their benefits every year. So,
Right.
we need to be pointing them out. Thanks again.
Yeah, no, thank you. And really, when I said, I'm here with business speaking first, and then me from the labor perspective. And in my career, I represented workers because I worked for unions my entire career for 34 years. But I also was management in the union, so I actually had a unionized workforce, and so I've worn both hats, right? So I really do understand this from both perspectives. And I'm telling you, there's no reason why labor and management we shouldn't come together on this thing and understand that we really do have a common enemy. Because what is the value added to the balance sheet for businesses when it comes to this particular, payout that they have to do? It generally is a major hassle. And the question was asked, why don't more businesses get on board? I've heard somebody once told me that some of the big corporations feel like, well, if government can put one sector of, business out of business, they could put any one of ours out. So there's just this real ideological fear sort of thing. The other thing is that some of those bigger businesses see it as giving them a competitive edge to offer a good, benefits package. Listen, Taft-Hartley Trust unions feel that way as well. We still battle with a lot of unions that feel that being able to say, come join the union because you're going to get a really good health insurance benefit if you're union, and particularly, in the building trades, because they've got competitors that don't necessarily offer right insurance, or really not good insurance. So I get it, but I do think that there is a way to still remain very, very, needed within the labor movement. There's lots of issues that we could be looking at, and when we look at Canada and we look at many countries that have universal health care, guess what? They also have very strong unions as well. So I don't think we need to worry about that so much anymore.
Les, go ahead.
Yeah, my dad was a labor lawyer, and there's only one, well, there's more than one Rose Roach, but not that many. Do you have a way if they talked about brokers, the
Mhm.
busy business owner only
Yep.
doesn't have time for this. Do you have advice, number one, on how to advise business owners which brokers to use? Or
Yeah.
like the Medicare for All deal where the broker gets paid more per the number of people into a certain
Advantage, Medicare
insurance plan.
Advantage. Yeah, yeah. Yeah, I don't have sort of like, oh, use this brokerage firm. I mean, look, that brokerage firms are in it to make money. I mean, that's the bottom line. Here's one story I'm going to tell you because I know we're pressing up on time, but I think this is worthwhile. This is when I was out in California. I worked out there for 11 years, and we got together with, I worked for school workers, public school employees, right? We got together with management in the public schools, and we formed a coalition. And we actually looked at what's driving healthcare costs, right? What's going on here? And one of the things we discovered, because we found this wonderful guy who used to be a hospital administrator, and so he knew where all the bones were buried, and he went into his own business and started working for pretty progressive, organizations. And for us, for the schools, he would come in and he would do a forensic analysis and audit of the renewal that the school district got, that they get, oh, this is what it's going to be for next year because you had people with cancer and, premature babies. And so we have to increase your premiums by blah, 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 right? And he would do this incredible forensic analysis. And 9 times out of 10, I'm not kidding, it was that much, he would come back to that school and say, yeah, so they're ripping you off. This broker in between, I found money here that they said that they're taking that makes no sense. Here they're taking money. Here they're taking money. On page 4, they said that you had too many maternity needs, and on page 24, they said you were less than last year. I mean, and he was able to bring that stuff, and then he would ask to get a contract with them. He wasn't with any insurance companies, and he would work with the district to truly find them the best possible plan for both them and for the workers. So it was a labor management, all the way. It was a labor management working group that was involved in this. We saved about, I think, it was about, I don't know, 100, 200 school districts out there. I can't remember the number, but almost $100 million in utilizing this entity that was able to go in and do a forensic audit and be honest about why you shouldn't use these doggone brokers, because they're just ripping you off. So I don't know that there's anything like that for private business, or that exists nationwide, unfortunately. But I thought it was an incredibly brilliant thing to do out there. And boy, did we save school districts a lot of money, because we found out that they were actually, they were pumping up those renewals 9 times out of 10. And as one of the business owners said, they don't have time. That's not what they're in business for. They don't have time to be, they have to rely on somebody else, or they have to hire a whole department, if they're big enough, to actually handle all of that stuff. These are all of the additional costs as you guys are going to get ready to talk about your universal study coming up. We've got one of those getting released this fall here in Minnesota as well. We made it very clear, like I guess you guys did too. The costs aren't just what the insurance company does. It's everything related to this crazy convoluted system. How many people businesses have to have? How many people have to be hired by doctors' offices and by the billing agents in hospitals, just because we have a system that they have to make sure we're coding to get paid, and all of that stuff is administrative cost that's unnecessary. I was with nurses in Canada. I walked through a hospital. I said, "Where's your billing agent?" They looked at me like I was nuts. They literally said, like, "Judy over there? What are you talking about, a billing department?" So, I mean, we don't have to do it this way.
Thank you so much, Rose. You are fabulous. We are always inspired by you and love working with you and learning from you. We're going to move on to the very end of our presentation. Virginia is going to describe the Stanford study, and then Kirby will finish the evening webinar event with just a couple of announcements. So, Virginia, go ahead.
Thanks, Jeannie. And boy, Rose, you are a hard act to follow, but I'll do my best. We've heard from Greg, Chip, Joe, and Rose that the high cost of complexity of corporate controlled health insurance is bad for business. I'd like to share a study published in 2021 by the Stanford Graduate School of Business. I ran across this when I was looking for material for testimony before the House Health and Human Services Committee on our bill. This is the headline of the story: "The Staggering Cost of Health Insurance Sludge. Dealing with health insurance administrators costs the U.S. economy billions in wasted work and time and lost productivity." So what is health insurance sludge? This is what Google says. Health insurance sludge refers to unnecessary administrative friction in health insurance systems, such as confusing claim forms, long phone calls with insurers, and delayed reimbursements, which waste time and reduce productivity. The author of the 2021 Stanford study says that a different study done in 2019 estimated that administrative red tape for healthcare providers, such as hospitals and doctors, was the single biggest source of waste in healthcare at $265 billion per year. He further states, until now, most of the research on health insurance sludge has focused on the paperwork costs incurred by healthcare providers, such as doctors and hospitals. Our new twist, which I can't believe nobody looked at before, is how much employee time is wasted across the economy and the measurable effect of that time on employee stress, burnout, increased absence, and diminished job satisfaction. The true extent of this waste is staggering. Here are 3 numbers that he quoted. Number 1, the economy loses $22 billion per year simply from the time employees spend on the phone with health insurance representatives. Number 2, companies lose $26 billion per year from extra absenteeism by employees who have to deal with health benefits administrators. Number 3, there's a link between spending time on the phone with health insurers and reduced job satisfaction. This costs the country an additional $95 billion per year in reduced productivity. Let's add up these huge numbers. First is the $265 billion per year in health insurance sludge for healthcare providers like doctors and hospitals, plus the $143 billion per year in health insurance sludge for employers and their employees. That's the sum of those 3 numbers I talked about before. So all of this together equals $408 billion per year in health insurance sludge experienced across the economy. That's a lot. Given that the U.S. defense budget in 2021 was $753 billion. And of course, spending has gone up every year. So these numbers are outdated by a few years. So it's probably even worse now. As Wendell Potter likes to say, it doesn't have to be this way. What I like to say is this: wouldn't it be great if we could come up with a simpler, more efficient way to pay for health care? Aren't we lucky that the Colorado School of Public Health is working on that right now? You're invited to attend 3 virtual meetings over the coming months where you can learn more about what the research team at the School of Public Health is doing. You will learn that their work is truly groundbreaking. Their work will help us understand what our next steps could be. See the links to register for these meetings in the chat, which Kirby has provided, and stay tuned. Thanks.
Thanks, Virginia. I'm just going to open it up for a minute or 2 of questions before we finish, because we're right at 7 o'clock. Any more questions for any of our presenters, and specifically, of course, for Virginia, who just presented? All right, I don't see any questions. Maybe we got a chance to ask them as we went along, which works great too. Kirby, if you will finish the webinar with your thoughts, we will be grateful.
Hey folks, I'm Kirby McLaurin in Durango, Colorado. I'm an organizer with various groups. I'm here to describe relational organizing, the most effective way to organize. Most folks think of relational organizing as asking folks to share info about a coming event. We think that can't be our primary promotion method, but sure, why not? Ask around, get a few more attendees, right? That's actually relational mobilizing, when we trigger a behavior in someone else. Pretty much all we see nowadays in the world of politics and advocacy. By contrast, organizing is based on and builds long-term relationships, which create the very structure of community. Changing our healthcare system is revolutionary because it overturns who's in control of whether we live, suffer, or die. Right now, powerful players have absolute control to deny our claims, extract our wealth, and keep us divided with ads and propaganda. American health consumers are beaten down. We have low expectations because we don't know any other reality than being treated like unimportant afterthoughts, waiting on the phone to speak to someone about our claim, right? And being told it's been denied. By who? On what basis? We must yield to a process conducted behind closed doors, which gravely affects our families' lives and our finances, with no power to argue for justice or fairness. Doesn't it just piss you off? We actually need to feel pissed off in order to resurrect a clear vision of what we should be receiving, in order to shake off our numbness, in order to envision what might be. There's a strong parallel to the isolated victim of personal abuse who doesn't know how to fight back and is beaten down. Each of us absorbs the corporate devaluation of our human bodies and minds privately, over the phone and via mail, and faces a landscape we must traverse on our own. Let's recognize that isolation is the key circumstance of our healthcare disenfranchisement. As long as we think we're alone in the tormenting madhouse, we cannot effectively change our world. So how do we fight back? Collectively, by building a movement for universal healthcare, we take control of our care in alliance with our healthcare providers, the good folks who joined a noble profession to care for people. They are fighting with us and struggling in their own way. Fighting the isolation is where relational organizing comes in, why it's centrally important to our work. Some of you may be familiar, but here's a brief sketch. Relational organizing is, again, the most effective way of organizing because it makes use of the natural social capital that we all have in our existing relationships, the love, loyalty, and trust that we share with our friends, family, and acquaintances. In this big society, we tend to think that things get done socially only via mass marketing, like by texting 100,000 people or via emails, ads, social media. Those methods can create marginal change, but they also turn people off, the opposite of what we're hoping for. They're impersonal, reinforcing the message of a big society that humans are small cogs of little consequence, therefore diminishing individual power. Disempowered individuals are passive and easily tuned out and controlled. We don't want that. Building a movement requires empowering people to think big, to envision what they want in life, and to imagine that they can create that reality. A movement happens when people think big together. They become active. They not only listen, but speak out. They feel important enough to feel heard. They show up and they're recognized as part of something. They feel ownership and belonging and become leaders in their own way. Relational organizing empowers each of us because it puts us firmly in the flow of information and action. We share information with our friends, attend events with them, and develop our own elevator speech about why it's time to claim a basic human right for every person. We get skin in the game by caring about the outcome of this effort, far more so than if we followed a link from an ad, because our trusted friend told us about it, deepening our relationship, and we shared it in turn with 3 of our friends. Our webinars risk placing each of you in a passive role, listening, taking notes perhaps, and signing up better informed but not empowered, a traditional didactic format in our big society. I'm here to challenge you to find your voice if you haven't already. My emails and social media cannot reach your friends, but you can. Each of us has considerable social capital that we simply cannot waste. You must spend it to connect your friends with your passion about why every human being deserves simple care, freedom from unnecessary suffering or death, and why, financially, we deserve it to have an efficient, comprehensive system. So what is my ask? Each webinar, bring in 1 more person to join you. Share what you care about with a friend to widen the circle. Then challenge them to do the same, and that's how we build a movement. Thank you for being part of this grand enterprise, my friends.
Thank you, Kirby, and thank you, everyone, for joining us. We look forward to seeing you Thursday, August 6th at 6 p.m. For another webinar. And please, as Kirby suggests, bring more of your friends along with you to participate. Thank you so much.